it? Right, yeah. No, it's fine.
Is that right?
Just left it my way.
All right. Good morning, everybody. Okay, good morning, Queensland. I have some really important news today, so I really need everyone to listen, and if we all listen and cooperate, we'll be able to get through this together. So I can report that we've had 10 new cases overnight, 6 are overseas acquired, and we have 4 community transmission, 2 unknown cases of one of the previous people. Then we have 2 under investigation, but we believe one of them is a nurse from the PA hospital. Now, what this says to us is the fact that there are now more community transmission, and these people have been out and about in the community, and that is of now concern to Queensland Health and of course concern to me. So Dr. Young will go into more detail about these particular cases, but what this means for Greater Brisbane is that we will have to go into a 3-day lockdown. This is the UK strain. It is highly infectious. Now, we need to do this now to avoid a longer lockdown, and that lockdown will commence at 5 p.m. this afternoon. That lockdown will be for Greater Brisbane, which is Brisbane, Logan, Moreton Bay, Ipswich and Redlands, and will commence at 5 p.m. this afternoon. That'll mean that our schools will close from tomorrow, and as I said, we need to do this. This will also enable our health authorities to get on top of the contact tracing. This is a huge job now that we have to do because we've got more of this community transmission. I know this will mean some disruption to people's lives, but we've done this before and we've got through it over those 3 days in the past, and if everyone does the right thing, I'm sure that we will be able to get through it again. So that means that people will only be able to go out for those 4 essential purposes, and Dr. Young will go into more of that in detail, but of course those 4 essential services are for food, for exercise, for essential work, and of course medical. Now, the other news is that one of these people also travelled to Gladstone. So that means now for the rest of Queensland we will be putting in that compulsory mask wearing for the rest of Queensland, and limiting gatherings to your own home to 30 people. This is essential, everyone, that we do this to stop further transmission. We've seen what's happened in other countries. I don't want to see that happen to Queensland. I don't want to see that happen to Australia. I know this is a really big call. I know it's very tough. We've got Easter coming up. We've got school holidays coming up. But let's do it now, and let's do it right, and let's see if we can come through at the other end. We'll also be reviewing it on Wednesday night as well. We'll know whether there's any further community transmission, because the last thing we want to see is our roads clogged on Thursday night heading for Easter vacation. So this is necessary. It's the UK strain, highly infectious, and the last thing I want to see is our most vulnerable in our community, or people ending up in our COVID wards in our hospitals. So this is a protective measure, but it's absolutely the right thing to do based on the health advice. Let me say that again. This is the right thing to do based on the health advice. We do not take these measures lightly. These are very, very difficult decisions, but they are done to keep Queenslanders safe. They are done to protect everybody and to make sure that we stop the spread of this UK variant. So look, I'll hand over to Dr. Young and then to our Health Minister, and then we're happy to take some questions. Thanks, Dr. Young.
So we have 4 new community-acquired cases overnight, which means that the current cluster that we're dealing with has 7 cases. The initial 2 gentlemen and now a brother of one of those that we think could be that link between the PA doctor who was infectious 2 weeks ago and this cluster. Then we have 2 colleagues of the second new case who have tested positive yesterday, and one of those people was in Gladstone for 3 days while they were infectious, so we're working very closely there to identify venues that person was at. Then very late last night I was notified of another case who happens to be a nurse working in the COVID ward. She did some shifts there, but I'm not sure that's where she's acquired it. We will need to wait for genome sequencing results that we should get back late tonight or tomorrow morning, which will make it clear. Her sister is also positive, and we're not sure where the transmission has happened there. Again, we need the genome sequence results. So we have 2 cases there that we're investigating as to how they acquired the infection. They have recently been in Byron Bay during their infectious period. So we now have significant community transmission and significant numbers of venues of concern all through Brisbane, and we know that people have moved from Brisbane out into the broader community, which is why I have advised that we need to ask people who live in Greater Brisbane, those 5 local government areas that make up Greater Brisbane, to stay home for the next 3 days until we can work out how much community transmission there has been, and we can contact all of the contacts who have been in these many, many venues. That's critical. So those 4 reasons that people can leave home, as were in place last year and in January this year when we had that 3-day lockdown, are, of course, for essential work and to buy essential supplies, food, medications and so forth, to look after a vulnerable person, and for exercise. And people, as in the past, can have up to 2 visitors to their home, and they can go out and exercise in a family group, or if they're by themselves, with one other person from a different family group. So that's very important, and all that will be put in place from 5 p.m. this afternoon, so people can complete their day. But I would hope, and I'm sure that this will not occur, that people don't choose to leave Brisbane during this time. It's important that people go home. If your home is normally outside Brisbane, you've come into Brisbane to work for the day, as we know a lot of people do, of course you can then return to your home. But anyone who has been in that Greater Brisbane area since Saturday the 20th of March is now required to follow those same requirements, that is to stay wherever they are except for those 4 reasons. Now, people who live outside Brisbane, because we know there has been a lot of movement since the 20th of March when these cases first appeared in the community, anyone outside Greater Brisbane, those 5 local government areas, has also had restrictions placed upon them. We will also be limiting visits to aged care, to disability accommodation services, to hospitals and to prisons, because they are the most vulnerable in our society. Plus, people can only have gatherings in their own home of up to 30 people in total. And also, anyone who's going out to dine or to go to pubs needs to be seated. So the 1 per 2 square metre requirement remains, with that additional requirement that people must be seated. And that's very important because we know that reduces mingling. Then the other requirement is, could everyone please wear masks? So in Greater Brisbane, that's for everywhere, that you're indoors, unless you're in a single room by yourself, of course not in your own home, but if you're elsewhere, unless except if you have a medical exemption, so you can't wear a mask because that would be dangerous for you, or you're doing extreme physical exertion, again, that would be dangerous. Really, it's important to wear a mask. So when you go to the shopping centre, when you go on public transport, when you're in a ride-share car, please wear a mask. Then from the rest of the state, outside the 5 local government areas that make up Greater Brisbane, I'm asking that you wear a mask when you can't physically distance, when you're inside and in public transport. They're the important risk areas. So if people could all please get out those masks that I know you have. There is not a requirement to wear a mask outside, particularly if you can socially distance. Thank you.
I might just add one thing before handing over to Yvette. So today we're declaring from 5 p.m. Greater Brisbane a hotspot. So my recommendation to other states and territories is that they should declare this Greater Brisbane a hotspot as well. And I think that's worked very well when we did that last time. Once we declare it, we're asking other people around the country to do that same thing and declare it as well. Thank you, Yvette.
Thank you, Premier, and I will be making a phone call to the New South Wales Health Minister after this press conference as well, particularly because 2 individuals have been in Byron Bay while they've been infectious. So can I just remind people, again, no matter where you are in Queensland or if you have been travelling in Queensland since Saturday the 20th of March and you've been in Greater Brisbane, if you have any symptoms whatsoever, please get tested. So it's not just people who have travelled in Greater Brisbane, but anyone, as we have been saying since day one. If you have any symptoms, please come forward. We've had over 11,000 tests in the last 24 hours, so we thank everyone for coming forward for those tests, and we want that to continue. Also, in relation to masks, can I say this to the public? Can I just say in relation to mask wearing, it will be mandatory to wear masks in public, but the Chief Health Officer has said there are some exceptions to that, particularly those who, for health reasons, cannot wear a mask. Don't take it upon yourself to confront individuals. We've seen in the past when we brought in these restrictions, people becoming abusive to other people that they would see out in public not wearing a mask. Leave it to the compliance officers. We don't want people getting into arguments and abusing people in public. We want everyone to do their part. So please, it is mandatory unless you have a health reason to not wear that mask. It is mandatory you wear that mask, and we ask everyone to be compliant. Continue to get tested. Please check the COVID Queensland website. So we will be updating a number of these people. We only found out they were positive throughout the evening. There is a lot of contact tracing to occur, and we need to identify the venues. So 4 more people means they've been travelling, they've been out at venues. We need to get the list of where they've been, and we need people to listen to the directions, to check the website if they've been at any of those sites, to follow whatever directions we put on the website in relation to those sites, and of course get tested and quarantine as per those directions. And we'll make sure that that information is available as that information becomes to light with the contact tracers, who I know are working really hard at the moment with all of these individuals to get that information as quickly as we can. And we thank the individuals who are positive themselves in working with our contact team and providing that information. Thank you.
Well, the fact that we've got more people, there's going to be a lot more venues, and we'll be updating the public, of course, during the day where those venues are. But we have to act swiftly. We've done that before, and that's exactly why we are doing it again. I apologise for the inconvenience that it's going to cause people, but health has to come first here. And I think the public would be unforgiving if it was out of control and we had not taken these measures. So I have to act on the health advice. I've always acted on the health advice, and that is the advice that Dr. Young has provided to both myself, the Deputy Premier, and to the Health Minister this morning, and we have accepted that advice in the best interests of Queenslanders. Well, I didn't sleep last night, so I think I am very worried. I'm very concerned, but this is, we've done it before, we've got through this together, and I'm sure that if everyone does the right thing, we will be able to get through it.
Do you think it's likely this lockdown will go beyond 3 days?
Well, last time was 3 days, and that was all that was needed. So, look, fingers crossed. It's going to really depend on how our contact traces go over the next 24 hours. Yes, in that Greater Brisbane period, over from 5 p.m. This afternoon. And can also please put out to everybody, please do not go and panic buy. The supermarkets, the shops are full of supplies, and you will still be able to go out and get food as part of this lockdown. So please don't go out and panic buy today. The shops will operate, the food shops will operate as per usual. Yes. So.
So the 4 cases of community transmission, are 2 of those linked into unlinked?
Yes, 2 of them are linked to our second case. So they were work colleagues, and then we have 2 other cases that I don't know the situation at the moment. They will, of course, end up being linked. We'll work it through, but at the moment I just need to wait for the genome sequence.
Given that this is already probably one of Brisbane's or Queensland's worst case clusters so far, given the one in January was only very small and the one back in August was contained to that prison area mostly. And do you feel that this is the worst outbreak we've seen so far?
No, we had 55 cases related to the Brisbane Youth Detention Centre, the 5 initial and then another 50. So no, we will work this through.
Just to clear, the Strathfire man and the second one who had close contact with these 2 were they housemates? Or work colleagues?
I believe, well, both were work colleagues, and I believe one of them was also a housemate, but that's been confirmed. Remember, we only received this information late yesterday, so we're just going through all of that now.
Do you expect there's going to be more cases tomorrow and the next day, even though we're in lockdown?
Well, we'll have a lot of people in quarantine and we'll be testing them. But remember, if you've got someone in quarantine, they haven't been out infecting people. So that's what we need to do now. We need to get as many people in quarantine as possible. These 2 work colleagues were in quarantine, but they'd already been out infectious before they got into quarantine.
Is it possible the Gladstone region's going to face tougher restrictions?
We need to find out what venues that the gentleman went to while he was there before we can make that call.
What can you tell us about the 2 people who went to Byron?
Yes. Yeah, they are the 2 that I don't have full information, that I need to wait on the genome sequence because I don't have a direct link to any of the other cases at this point in time. Yes.
Do we know when they were in Byron?
Yes, we do. I'll just check from the 25th of March to the 28th of March. Oh, sorry, I apologise. Sorry, that was the gentleman who was in Gladstone, was there from the 25th of March to the 28th of March. I'm not sure that I have the Byron dates at this stage, but I'll be letting New South Wales know that as soon as we've got that. Sorry. Yeah. So yesterday 11,626 tests were done on 6,130 people, but the really good thing that I've been seeing over the last few days is most of the tests have been done on people in Brisbane. So that's been critical. So we've really seen a massive increase in testing rates in Brisbane City and also in that surrounding area. Every single person who's got any symptom.
Dr. Young, will daycare centres also be closed?
No, the same as what we've always done with previous lockdowns. So they'll remain open, of course, because essential workers still need to go to work. I mean, we know the essential workers and they're critical that they continue. So schools will remain open for children of essential workers and for the children, for vulnerable children, as they did in previous lockdowns. Yes.
And just to clarify what you made earlier, so all venues or restaurants outside the Greater Brisbane area will have to have seated eating?
That's correct. And drinking, so in pubs as well.
So she was at the PA hospital.
Yes.
And then you believe
I believe so, but it's too early to be definitive about anything. We just have to work that through. We don't know. It's too early. There are all the questions that, of course, are being worked through now. No, she hadn't been vaccinated. She'd been on leave.
Do you know any more about the link between the first case, the 26-year-old landscaper, and the PA hospital?
Well, there's his brother who's tested positive on serology, so I believe that he's infected, although we can't definitively prove that because we don't have genome sequence because the brother didn't have any virus. But yes, I believe that the brother has infected those two first cases. I don't know the link back to the hospital. I don't have that.
If the nurse was on leave, do you think there is any way that there was an overlap with the doctor who tested positive?
They're all of the things that we have to look at. It's just, this is happening very, very quickly. It's evolving.
And how often are people who are working on COVID wards being tested? Is that at the start of every shift? Or
No, it's not every shift because they're wearing full PPE, so it's intermittent.
do we know when her last
I don't have that information. You're asking all the questions I'm asking. I don't have those answers yet. As the Premier...
I've had word that the Prime Minister has accepted the halving of those international arrivals. But as you can see, because we've got more people with COVID in our hospitals, they are highly infectious and the risk is greater of that being passed on. Yes, I answered that question. I think it was around 1,300. Yeah, 1,300. Now that'll be halved. Yep.
Just on another health matter, I don't know whether you're a vet can answer this. There's a story in the papers this morning about twins with spinal muscular atrophy, and it depends on a test which isn't available here.
Look, I understand this is a test that's only done, I believe, in New South Wales, and it might be Tasmania or the ACT. It's only in 2 jurisdictions currently. I'm interested in knowing whether there can be a trial. I understand that is under consideration, active consideration at the moment by the Department of Health, but I am interested in knowing what would be involved in a trial and what we can do going forward. So yes, I have become aware of that in the last couple of days, and I do think it's worth us at least exploring.
Just while you're here, an update on the Strathclyde man. Queensland Health released on Saturday night said 25 attendees of the party have been placed into quarantine. Can you clarify if that would be attendees from the party 2 weeks ago, as we now know, and if they were placed in quarantine, where are they now?
Well, we clarified all of this yesterday. We made it clear that what has become clear from the information that had been received over the last 48 hours is that, yes, the gentleman did have a party, but it was 2 weeks earlier. It appears that might not have been clear at the time when the health officers first spoke to him when that party had occurred, and it was certainly believed at the time that it was that Friday night. So the Premier has already commented on this, as have I, and we're just pleased that it is only the housemates and they're all in quarantine.
Yeah. Yeah, look, this is going to be part of the Australian way of life until everyone is vaccinated. So it's very important that the vaccination rollout continues and that people continue to book in with their GPs, especially those GPs that are administering the vaccine. But until we have the population vaccinated, there is, of course, the risk of community transmission. So by today declaring that Greater Brisbane a hotspot, I'm asking all other state and territory leaders to do exactly the same, and hopefully, fingers crossed, like our last 3-day lockdown, it gave our contact tracers the opportunity to get on top of everything. The halving of our international arrivals will also contribute to us being able to focus on the task at hand, and hopefully after the 3 days we'll be able to update Queenslanders. Correct. Yep. Yep. No, it'll be tomorrow. Each day we give an update. We'll be putting out a lot of information during the course of the day as well, and I urge people to look at the media or our Facebook page to get the most up-to-date information.
This will come up. Do you have to wear a mask while you're in your car?
No, you don't have to.
Cafes and restaurants, can they open for takeaway?
Yes, of course. So I'm quite sure the takeaway will do very well. But we're just asking people to do this for the next 3 days, commencing at 5 p.m. Also encouraging employers where they can allow staff to go home a bit earlier this afternoon. That also would be helpful under the circumstances.
Does that mean we're effectively banned from entering those states?
They would have to comply with the measures. So if they came in from interstate, my understanding is that they would have to also go into lockdown and abide by that. Yep. Okay. Thank you everyone. Thank you.